Good morning. Morning,
Good morning.
Dr.
Good
Lata
morning.
and Dr. Vidya. Thank you very much for being with us. This is a special day, but also it's a painful day, with what's going on in India. I think everyone is aware right now of the terrible situation in terms of COVID spreading quickly, a large number of patients being affected, and also the impact of the crisis in terms of overwhelming the healthcare in India. So all of us seen this report on CNN and Al Jazeera and BBC, where you have patients who are waiting in the parking lot of hospitals, waiting for oxygen, and some of them, unfortunately, or many of them, are dying. Dr. Jha, who is one of the epidemiologists in the United States, he's originally from India, mentioned that yesterday India was the country that has more cases than any other country on a day, in one day, more than 402,000 cases. The positivity rate is 21%, which means that there's many cases undetected. More than 3,500 people died yesterday in India, and this is an underestimate, according to him. And he's one of the world's authority on COVID and so forth. At least this number, the number of death, is the actual number is higher 3 or 5 times than the real number. So, Dr. Lata and Dr. Vidya, you want to introduce yourself to people who do not know you? Go ahead, Dr. Vidya, and then Dr. Lata.
Good morning. Thank you, Dr. Soho, for having me. It's quite an honor to be on your program today. My name is Dr. Vidya Bansal. I'm a pediatrician, and I'm also the founder and executive director of Desi Physician Moms of the US and Canada and the DPM Foundation. So we have approximately 7,000 members who are all physician women based in the US and Canada who have some connection to the Desi region, which refers to the region of India and Pakistan. And we also have attached to us a nonprofit organization which helps with various issues that are important to our members. And thank you for having me.
Thank you, Dr. Vidya Bansal. And Dr. Lata, my friend, we've been together in one of the medical missions of MediGlobal to Sierra Leone. And your encyclopedia, I mean, that's the way I imagine it. You knew every disease, you knew every detail. So tell us about yourself.
Hi, I am Dr. Lata Cherath, and I'm an internist in Philadelphia. I actually straddle both these. I am a member of the DPM, where there is the founder, and I am also a member of Med Global. And like Zaire said, I have worked with Zaire, and I am so honored that he is my friend. Um, yes, the COVID situation has been very disturbing, and all of us have experienced losses, personal losses of my best friend, of family members. And so I'm very passionate about this, and I am grateful that you invited us to give us our perspective,
No,
Zaire.
I think people ask, and I have this discussion with nurses in my hospital. What's happening right now in India? What led to this crisis? In the United States, of course, we had this last year was very painful to most of us. I'm a critical care specialist. I've been seeing many patients who were admitted to the hospital, to the ICU. Many of them died. We had more death in this country than any other country, 560,000. We're still seeing new patients in COVID in this fourth surge in the United States. Although the numbers are contained and the numbers are now going down, I think because of the vaccination campaign, about 40% of people in the United States have been vaccinated, at least received one dose. So why is it that we are having these huge numbers in India? We thought that things were under control in India based on the after the first surge. So what led to this
Absolutely.
crisis?
Well, that's a great question. And I'm very glad that you made the parallel between the US and India. I think most people, as you mentioned, are familiar with the state of crisis that the United States was in the spring and summer of 2020. And it has been fairly well controlled here. And your question is correct that your staff and your nurses have, when they have made these observations here, why was the situation very different in India? So I think a lot of what we are seeing in the media now is very quick to blame one or two specific aspects of the government response and the social response. However, this is a broad, multifactorial base that needs to be considered. Bringing back the parallels to the United States, if you think of New York City and the crisis that they were in, and then you consider the population and the resources of India. In New York City, if you can imagine New York City on New Year's Eve, that is one day, one occasion. India is like this everywhere on any given day. That is the population that we're dealing with. And then you put COVID on top of that. So you have 4 to 5 times the population of the United States in less than 1/3 of the space. So the social distancing is on a regular day, pre-COVID, not possible. The outside in India is the inside here. So when you talk about lifting mask mandates towards the inside here, because the outside you have the ability to socially distance. In India, you do not have that space in which to do so. Let's also consider the infrastructure of India, which has been there for decades. The infrastructure there is one of mass transit. It's very different from the United States. Again, it does not allow for social distancing. That is the way of life there. The healthcare spending, 2018, the World Bank reports a GDP of 3.5% in India that is allocated to healthcare. This is well under the international average of 10% and far under that of the United States, which is 17%. Much of the vaccines and the medications that India produces goes for exports. Indoors, when I say indoors, I mean within the country, in India, the healthcare system is quite different. A person is able to go to a pharmacy and simply ask what they would like. The pharmacist may recommend, they may have a prescription. Those are based on cash. So the healthcare system and the literacy are not tied together the way that they are here. You also have a discrepancy in the number of doctors. In India, it is 0.9 per thousand population. This is under the average of the world, which is 1.6 per thousand, and very well under the United States, which is 2.6. This leads to people not having access to a doctor and going back and resorting to the cultural denial and the cultural reliance on homeopathic remedies, which have not been proven to work for COVID. So with this, the government did have a very good response in March of 2020. They ensured very strict lockdowns. However, there was underreporting, as you mentioned. There was a lack of testing. Even with the testing, there was a lack of reporting. And India was reporting 500 cases. And in our group, we were shocked. Why? Why? Is it the climate? Why? And most of our inside network reported to us mass underreporting. The task force, which is similar to the task force that you see reporting to the White House and giving guidance, did not meet this year in February, March, and April. They declared victory. They declared victory far too soon. At the time of the lockdown, there were 500 cases. The mandates were lifted. This led to resumption of normal life without a systematic phased reopening. Weddings resumed, cricket matches resumed, religious gatherings, political rallies, because it was an election year in battleground states. On January 28th, Prime Minister Modi at the World Economic Forum declared that we had, quote, saved the world. At this point, there were 18,000 cases. On March 7th, the union minister declared it an end game. And this was clearly not the case, because now we had 53,000 cases, and he said that the situation was, quote, under control. Fast forward to just a few days ago, April 17th, we had 261,000 cases, and Prime Minister Modi was similarly what we had seen in 2020, boasting of huge crowds. Currently, we are at the phase of 400,000 per day, with well over 3,500 deaths per day.
So, Dr. Cherath, we've seen these pictures of political rallies and religious gatherings. I guess this is something that we've seen also in other places in the world, where the government felt that they can relax the restrictions because of the public pressure. There's definitely COVID fatigue, even here in the US. We've seen that these scenes multiple times during this last year. Political rallies, gatherings, big parties on the beach in Florida and other places. And also because governments sometimes were irresponsible, like in Brazil and other places, including here,
Absolutely.
unfortunately. So, do you think that it is the government's responsibility that led to this crisis, or is it the public, or both to be blamed?
I think both, because I think definitely, like Vidya stated, it is absolutely correct. When COVID first started, India went into lockdown almost immediately, and the infections were kept under tight control. But then you also have to realize that India is a land of what we call the gig economy. There is just literally 3% of India which actually pays income tax. The rest of it is, people doing daily wages jobs. So in a country of that scale, how long can you actually keep a country under strict lockdown? What measures can you actually use? Regardless of all that, India was successful in initially keeping tight control. And then, it was actually hailed as victorious by media all over the world. And then in Jan 2021, the Prime Minister actually said just what Vidya said, that India's success is unparalleled. The country relaxed restrictions, and then that led to people mingling, the political rallies, because it was election year, religious observances, and the low vaccine coverage. There was a period in India when vaccines were first being introduced. People actually said we don't need to take the vaccine because Prime Minister Modi just said that there is no more COVID. And it is just ironic that in India, in Hinduism, there is a major pilgrimage and a festival called the Kumbh Mela, which actually occurs once every 12 years. And of course, 2021 was one of those years. And this is a massive pilgrimage where Hindus from all over the country come to the banks of four what are regarded as holy rivers. And there is religious chanting, there is everyone takes a dip in the river, there is religious discourses by the saints and the monks, mass feeding of the monks and all of that. Of course, no one is masked at any of these events, and the government sanctioned the Kumbh Mela. And the people, of course, flocked to that. So there were these huge super spreader events. Then, among the political rallies and the polls actually happened, and people were, actually encouraged to go and stand in lines at the polls. Then there is, the low vaccine coverage. Even now, less than 4% of the country has received both doses of the vaccine, and 11% have received the first dose. And then there is the vaccine shortage as well. So it is definitely the government has to take some responsibility, and I would say actually majority of the responsibility, because had we probably maintained those initial the initial restrictions, we would have been in a better place by now. Right now the scale of the crisis is it's like the horse has left the barn. That's where we are now.
So, talking about the real numbers, and by the way, these religious gatherings are not unique to India. I mean, we've seen the same scenes a couple of days ago in Israel, where you have a stampede. Actually,
Absolutely, yeah.
more than 60 people died because of this large gathering of Jewish people of the Jewish faith in Israel. Also, I mean, during my travel and recently, I've seen scenes of people of the Muslim faith filling mosques in areas in Syria against the preventive measures, because they believe that they are immune from the COVID because they are observant. So this kind of attitude of challenging the preventive measures just because you believe that you are faithful is there in all religions.
Absolutely.
So, in terms of the scale of the crisis, I mean, I've read a New York Times report recently about the actual numbers in Russia. Russia has reported 57,000 people who died of COVID. And the New York Times looked at the excess death last year, I mean, 2020 in Russia, and it was about 380,000 people extra death than the previous year, which means that if you want to extrapolate, it's 6 times more than the reported numbers. So what do we think that, I mean, the actual numbers in India? I mean, some people said more than 3 times, more than 5 times. You've seen these scenes of people dying in the parking lot. They're not tested or at home for COVID. So what do you think the real scale? I mean, I know from my Indian friend that everyone knows several people who died actually of their families, young and old, of COVID. So this is much higher than what we're seeing.
Absolutely. I think the numbers of the death is grossly underreported. It's a Hindu country, so the bodies are cremated. There are long lines at the crematorium. So the families are actually burning their loved ones on little pyres in the open air. So, India's night sky is actually aglow with light from these funeral pyres. I think it is the University of Washington's model which predicts that India will reach 1 million deaths by August 1st. It has, the country has reached or passed the breaking point. The surge was astronomical and totally unexpected. Right now, when you're talking about the scale of the crises, right, the intensive care units are operating at full capacity, and nearly all the ventilators are in full use. The oxygen supplies have run out. The jumbo cylinders that provide the oxygen in the smaller hospitals, of course, many of the smaller hospitals don't have their own oxygen plants. They ran out of oxygen and there is not enough available, and neither is it obtainable quickly enough to meet the needs. So the hospitals have to ration the amount of oxygen that they can deliver. There is this, the HFNO, which is the high flow nasal oxygen, and that's a comfortable way for the patients to get the oxygen. It delivers better ventilation as well, but that has been cast aside by all the ICUs because they simply cannot provide the amount of oxygen to one single patient. The patients are asked to bring in their own oxygen supplies if they are able to obtain a bed. Then the demand for the medications like remdesivir, monoclonal antibody cocktails, the anti-interleukin 6 monoclonal, all of them, all of which are imported, of course. The demand was so high that the supply could not meet the needs. Delhi, which is the capital of the country, ran out of even the dexamethasone tablets. And Delhi has an odd situation. It is India's capital, but it's also the drainage area for several of the northern states in the world, because those states lack the resources that Delhi has. So all the inflow is into Delhi. All the sick from the neighboring countries end up in Delhi, which is why it's right now having the worst crisis in the world. I think a surge of this kind would have paralyzed any country in the world. But when you have a population of 1.4 billion, which is about 20% of the world's population, this virus could and easily bait all the odds.
So Vidya, this looks like a real overwhelming of the healthcare system that led to the scale of the crisis. So we've talked about that in the United States, that at one point, especially after the first surge or during the first surge, that will run out of ventilators or with hospital beds. But many hospitals, including my hospital, which is one of the largest in Chicago, we did some adjustment. So we opened more beds, we got more ventilators, we had more floors assigned to COVID patients. We put 2 COVID patients in one room instead of one in the ICUs. We even talked about connecting one ventilator to 2 patients, although we did not have to implement this because of the shortage. Of course, the same thing goes to medications that we did not have abundance of in the beginning, like remdesivir and others. So, do you think that the healthcare system in India right now is overwhelmed? That's why we have this huge number of people who should not have died, right? I mean, these patients should have oxygen, and they're dying because of lack of oxygen. In the normal situation, if the things are under control, should not have died.
Yes, you're right in some way. However, the multifactorial issues also need to be taken into consideration. Going back to the previous question and tying into this question as well. So India is not necessarily a Hindu country. India encompasses all religions. So going back to, in fact, it's one of the largest countries with, it's one of the countries with the largest Muslim population as well. So the cultural norms.
There are more Muslims in India than Syria,
That's
my
right.
homeland, and many other Arab countries.
That's absolutely right. And that is one of India's very proud heralds, that we are multi-faith and multicultural and multi-welcoming as well. So I do want to point that out. Regardless of the government that is currently perhaps maybe giving the impression of otherwise. But the fact remains that India is very multicultural. Going back to the underreporting, what is being reported is the cremations largely, because that is what is on the media attention. I do want to stress that when the media is showing fire, that is representative of the cremations that are going on, but that also represents someone's mother or someone's father. So it is more than a picture that we see. And we are also not seeing the burials, which Muslims and Christians traditionally bury. So this is something that we are not seeing in the media and is giving the impression that only the Hindus are dying because India is a Hindu country. And this is most definitely not the case. So going back to the underreporting, going back to this perfect storm of all of these multifactorial issues, including the infrastructure, including the lack of resources, including a difference in the healthcare system, including some of the lack of the ability to have the ingenuity that you described, that the critical care physicians were able to utilize here. With a struggle comes the means, I agree. With that, we invent new measures to accommodate the current crisis. I do agree. However, the physicians there, it is not for lack of intent. It is for a perfect storm. This virus, when you had all of these super spreader events going on, it did what it needed to do to survive, like any living being. It is a living being that is just trying to survive and doing what it can, and it mutated. And at first we were seeing the UK strain, and then it mutated again, and it's called a double mutant, but I'm not a virologist. However, my understanding is that it's actually got 3 mutations, but it's called a double mutant because the 2 mutations have never been seen on the same virus before, and this is unique to India. When you throw all of this at the hospitals, at the doctors, there is only so much that they are capable of doing. If they don't have the oxygen, there is no question of connecting it to 2 patients. If they don't have the ventilators, there's no question of point of connecting it to 2. So you have a perfect storm, and the system was unprepared because of the existing pre-COVID measures that were in place. The entire system was not prepared. From March of 2020 until the current situation, the United States and other countries were able to secure a lot of equipment, a lot of medications to prepare for the second surge. The Indian government did not prepare for a second surge because they did not believe that a second surge would take place. So the result of that, going back to the scale of the crisis and how it has affected the grassroots level at hospitals and our own physician colleagues in India, is a complete collapse. And we already didn't have enough doctors, we already didn't have enough facilities, and now you are throwing this perfect storm at these facilities and at these physicians. One of the biggest crises is the emotional turmoil that is now taking place. We are seeing physicians working in hallways with blood thrown throughout the hallway because there are riots breaking out due to lack of a family member getting a bed. There are doctors outside in the streets of the hospitals reporting to work and being caught and being beaten because their family member did not get a bed. It is a war zone. And it's a complete diabolical, apocalyptic crisis. And it's not just getting the oxygen, it's not just getting the bed, it is a complete emotional turmoil as well, which is leading to further collapse of the system.
I mean, that's really painful. We have established in my hospital in Chicago guidelines on which patient they needed to be accepted to this very advanced way in treating patients with severe respiratory failure related to COVID, called ECMO, which is exchanging oxygen outside of the body. It's very expensive. It needs special expertise. So we could not, of course, accommodate everyone. So we had to put guidelines that the patient should be below a certain age, that patient should more likely live if we provided this technology. They should not be in severe shock or multiple organ failures or things like that. But no, I've never imagined that, maybe similar guidelines should be done for oxygen.
I
Um,
know.
in the United States, oxygen is provided in all hospitals, and unless in maybe in some rural areas, through oxygen generators that every hospital has. These hospital generators, you basically just connect the patient to the central oxygen supply in the patient's room, and they get abundance of oxygen from 1 liter to 70 liter per minute with high flow nasal cannula. You don't really think of where is this oxygen coming from. It's of course in every hospital coming from the oxygen generator outside that is extracting oxygen from the air and delivering it to the patient. And there is unlimited supply of oxygen, as far as I know, in every hospital in the United States. In other places in the world, I guess most of the world, they provide oxygen through these oxygen canisters, which we've seen pictures of in India and other places. I mean, by the way, this oxygen shortage happened in Egypt, happened in Gaza, happened in Syria, happened in Yemen, happened in Brazil, of course, especially the Amazon state, and that led to many people dying. So these canisters have been provided to every patient, and every patient can consume 2 to 3 canisters of oxygen every day if they're on high flow. And most patients cannot be treated in the hospital because there's limited capacity of hospital beds. So they are treated at home, and at home they are given these oxygen concentrators that also extract oxygen from air, and they can get up to 10 liters maximum at home. In Syria, we had this experience where provided actually oxygen concentrators to patients to be treated at home. The perception that India is the pharmacy of the world, and it's not perception, it's reality. India produces more medicine than any other country in the world. Actually, they're producing more COVID vaccine than probably any other country in the world,
Yes.
with the Serum Institute in India. And we thought that the healthcare system has capacity, just even in case that you have an epidemic like this or pandemic like this, that you will have in India a space where you can give oxygen, you can give extra medications, and so forth. So, why is there a shortage of oxygen in India and medications?
Because they were totally unprepared. They had declared victory over the virus, so this was completely unexpected, and nobody predicted that this would happen. And you have to remember that it's a country with a population of 1.4 billion. About 18 to 20% of the people in the world live in India, and that's roughly 1 out of every 5 people in the world. And with which Vidya mentioned, that US, it's about a third of the size of United States. So it's an extremely densely populated country. There is no distancing possible. So the transmission and the surge of the virus, if you look at graphs, it's literally a straight, absolutely vertical line. And this surge led to, unmeetable demands that simply overwhelmed the structure. Uh, there was some miscalculation on the part of the government regarding the vaccines. India is the vaccine factory of the world. It produces 60% of the world's vaccines, made in the Serum Institute in Pune and Bharat Biotech, which makes the Covishield, I think. Or the Covishield is made by the Serum. There are 2 vaccines in India: the Covishield, which is made by the Serum Institute, and the other one, the Bharat Biotech, makes the Covaxin or something. But the government was so confident that we would meet the requirements and the demands and stuff. They actually were even donating vaccines to other countries. They gave it to Sri Lanka, they gave it to some African countries, they gave it to Brazil. Nobody thought that it would come to a point where we would not have the ability to manufacture vaccines to meet the needs of our population. And then I think when part of the other thing that happened was when Biden invoked the Defense Production Act, and then that put an embargo on the export of the raw materials for vaccine production to India, and that embargo was to last 6 months. So that also made the vaccine materials, the raw materials available to India. They were short supply. They were in short supply as well. So that led to the dearth of the vaccines. But again, it was a miscalculation on the part of the government, and I guess in some sense, a lack of vision.
Do you want to add anything, Vidya, on this? Why is there a shortage of medicine in the country that produces more medicine than any other
Well,
country?
a large proportion of the medications and vaccines are allocated for exports. And I am not familiar with the Indian system and the regulations that guide those. However, what I am hearing from the situation on the ground is that every location is different. So one particular facility in one particular city may have oxygen, but they don't have the cylinder to be able to take it to the oxygen to refill it. Some situations are the opposite is true. They have the cylinders, but they don't have a means to take it to the facility to refill it when it is available. So what we're seeing is it's every location is different. That's the bottom line. Some have the ICU beds, but don't have the ventilators. Some have the ventilators and don't have the monitors. And some have all of that and don't have the oxygen or the treatments or the medications. And this is why the patients are being given the burden of finding, obviously not beds, but finding medications and their own oxygen to bring, because they have a system there where you can go to a pharmacy and ask for it, or a doctor will write down the name and ask you what to bring. The United States, the difference here is that the United States has a centralized system of connecting hospitals through various associations and different associations which guide the management, the Pediatric Association, the Pulmonology Associations, for example. India has those associations, but they are not completely connected with the suppliers. So we have administration here, which is far greater than the administration of hospitals in India, with a far less interconnection there. So there is a disconnect between the hospital communication and the hospital need and where they are able to procure some of these supplies. So in some cases, with some certain medications and supplies, there is an availability, but that chain to acquire that is broken. In some situations, the opposite is true. So again, it's a multifactorial base, and it is. I can see how it is confusing that India produces a lot of these, but it is not available to its own people. And another issue here is the cost. You also have a black market in India, which is something that we do not see as such of a large scale as in the United States. So a lot of the equipment and medications that are being supplied, pushed out, made available to people are going into the black market. And the corruption issue is nothing new to COVID. It's nothing new to India. It is unfortunately very much alive and part of its culture in all aspects, in education, in law enforcement, in the judicial system. It is there everywhere. It is not unique to healthcare, and it is not unique to COVID. And this situation has only amplified an already overwhelmed system, and the black market is there to monopolize on it.
So I think one of the people who are seeing this conversation, Rao from India, he said that, and you mentioned that there's hoarding of oxygen in India, and we've seen that, by the way, in Yemen, in Lebanon, in Syria, other places where the price of the oxygen concentrator went up from $200 to $600 or 1,000 even in Lebanon. In Yemen, recently we provided oxygen canisters through MediGlobal to some of the hospitals. The price of the oxygen canister or cylinder is about $100. We had to pay $270 because of the hoarding and the exploitation. He mentioned that the oxygen concentrator right now cost about 85,000 rupee, and used to be 20,000, which is most people cannot afford to do that. So people ask, first of all, should we help? Of course, I mean, that's a simple question. Of course we should help. Of course, if you save one life, that's enough, even if you put all kinds of money for that. And any amount of donations to any organization that is helping in India is not too much. So donate generously to any organization that is helping. But how can people help in the United States or the rest of the world or in India? I think both of you are involved in within an organization that is doing some work. There's many other organizations that are collecting money for India. and this money will be translated into oxygen, into medications, into medical supplies. So you want to tell us about how can people help?
Absolutely. So part of this, part of the issue is that everyone wants to help, but does not know how to help. And that is completely natural. It is completely understandable. Everyone has their own strengths and their own areas where they are unsure. So if there is an intent to help, we can all come together and find a way to make that happen. And with a multi-team approach, I think that this is best. One of the things that we are doing within our physician networks, normally pre-COVID, pre-collapse of the system, we have a population of physician women who are well connected to physicians in India, Pakistan, the Desi region. We are in a position of privilege in that under normal circumstances, physicians come from families of physicians, and all physicians have classmates who are physicians. And when we normally are able to make a phone call and get inside connections to patients, we are normally able to do that for our family and for our friends. However, when we are not able to do this, we cannot imagine what it is like for someone without those connections. So we have established an MD to MD network through our physician colleagues in India on the ground to ensure a non-corrupt transfer of funds and supplies that is directly supervised by our team with our members from the moment that the dollar is donated until the dollar actually reaches literally the hands of a patient and off of the black market. So we have established a fund called DPM Operation O2, and it's on our website, which is dpmfoundation.org. That's D as in David, P as in Peter, M as in mother, dpmfoundation.org. We also have a public foundation page with an event that is hosting donations there called DESI, DESI, Physician Moms Foundation. So on both, if people could go and donate, that would be a tremendous help for us. We have raised over $150,000 in just the last 3 or 4 days, which is quite remarkable. And we are being overwhelmed in a good way, but we can do more. We have identified several supply chains within the United States and within India that have these supplies that are needed, and we have been able to find them and keep them off of the black market, deliver them into the hands of our physician colleagues so that they are completely insured that without any administrative cost, because we are all complete volunteers, we don't have a staff. We're literally doing this 24 hours a day. Someone sleeps at 1 o'clock and someone else wakes up at 3 a.m. So literally with the time difference in making the phone calls, it's a 24-hour network of 100% physician women volunteers who are ensuring that every dollar donated, 100 cents out of every dollar is going straight into the supply with a non-corrupt destination. So if the second thing is that if we can get some assistance with a large corporation such as McKesson to assist with getting some of this equipment in through China where the voltage is not an issue. Sending them from here, again, you have a voltage question because you have the 220 volt there and 110 here. So a large company who is able to work with us, we've had people reach out that have the supplies but don't know where to send it to because they're afraid that it will get into the black market. So if someone can connect us in that matter to provide the materials, we are able to provide the safe destination.
So, I mean, you mentioned something that is very important. I think Mr. Rao from India also sent a comment about it, that make sure that these donations are not going into a corrupt place, because corruption is there everywhere, not only in India, but in other places in the world. So, and there are some people who unfortunately are exploiting the situation. So, your organization has 8,000 physicians, moms, and you're doing it directly from the United States or other places in the world to India, doctors to doctors, MD to MD. You're bypassing the corruption and the bureaucracy, and this makes these things donations safe. You want to add anything, Lata, on how can people help?
Yeah, absolutely. I mean, I completely second what Vidya said. You know, their organization, their foundation is doing wonderful human work, and I completely and wholeheartedly support it. Uh, I had today, this morning, I had a request from a friend about, and he is the person that I'm talking about. He is Dr. Amit Thadani. He is a thought leader in India, and he is a surgeon by profession. He, since the COVID started, all the surgeries have been elective. So he's actually converted, he owns a hospital, and he's converted his hospital to a COVID hospital. The reason I have to bring a personal story, the reason that I am in close contact with him is because one of my best friends passed away and she was in that hospital and he was, taking care of her. So that's how I established a connection with him. So he asked today whether it's possible to build an in-home oxygen plant. So that is something that would solve this oxygen problem permanently. In the large hospitals in India, like in the municipal hospitals or in the hospitals which have the teaching piece attended with it, they have their own power plants, they have their own generators. But the small hospitals in India do not have that. So he actually said that that is the need of the hour, a portable plug and play kind of unit. It is the size of a compact double door refrigerator. It will be a direct source of oxygen supply, so there'll be no need for oxygen cylinders. It gives a flow of about 90 liters per minute, which can take care of about 9 to 11 ICU beds or 18 to 20 normal beds. Yeah, it can be installed in a week and it can be moved easily. So, the cost is, steep, but he said even if we were able to partially fund it, he would be like, thrilled about it. So here is my philosophy and here is my ask of everyone listening to this. There are times in life when it's one's turn to give and you have to give. Give because others cannot. Give because we have the training and they may not have the training. Give because they don't have the resources that we do. Give because they don't have the privilege that we do. Whatever it is, when it's your turn to give, just give with your whole body and soul. Give it your all and all of yourself. Give because you cannot afford not to. And I think this is our turn to give.
I would like to also add one thing to that. When giving is most that is how one can directly help. The other very critical thing that we all can and should be doing, which is very easy and it's free, is that we should learn from the situation that has taken place in India. And your audience is international, but also largely based in the United States. Taking these lessons, taking the things that were discussed here, now that there is an understanding of what has taken place and why it has taken place, to learn from those things and to get vaccinated and to continue wearing a mask where it is indicated. This apocalyptic war zone nightmare, which is taking place now, could have been prevented with a larger scale vaccination campaign, similar to the one which is taking place in the United States now, without misinformation and with a good infrastructure in which to do so, both of which were not positive in India, which led to this. If there is an opportunity to get vaccinated, now is the time to do it. If India had been vaccinated last summer, this would not have happened, regardless of what political rallies took place, what weddings, smaller scale gatherings had taken place. This could have been avoided. So what can we do? We can all get vaccinated and we can all continue to wear masks.
And I think this is the bottom line, because we still have vaccine hesitancy here in the United States. There's more difficulty now to vaccinate who is left not vaccinated because of the attitude and because of the conspiracy theories, because of the feeling that the vaccine is more dangerous than the virus. And we're seeing the impact of the virus. I mean, I always tell my friends who are hesitant to take the vaccine that the virus is deadly, and death is irreversible. But the vaccine can have side effects that can last for one day, and it's reversible. And also, I mean, in terms of giving, give because saving one life is as if you saved the whole humanity. Thank you, Dr. Lata Cherath and Dr. Vidya Bansal, for being with us. This is very informative. Make sure that everyone shares this program with their friends. I think the information that we've seen here, we've heard here, I haven't heard it in any other programs that I've seen or even news article. Thank you very much for your leadership, for your generosity, and God bless you. Thank you very much.
Thank you also for all of the work that you do. This is something that has been thrown on us in the last week, and you do this on a monthly and yearly basis in many different countries, in many different disasters. So we have the most tremendous respect and a lot to learn from you as well. So thank you very much.
Thank you, Vidya. Thank you,
Thank you, Zaire. And I echo all of that. You are my hero. Thank you.
Thank you. Well, have a nice day and have a nice weekend, and let's help India, everyone. Thank you.
Thank you.
Yes.